For the diseases in chapter 21, I divided into two PowerPoints. This one is talking about hemorrhagic and non-hemorrhagic diseases, and then the other one is just on all other diseases. So looking first at the hemorrhagic fever diseases. So of course they get their name because they cause internal hemorrhaging. So we're talking about it because it affects the blood and the lymph. These are caused by RNA-enveloped viruses, and they are mainly distributed by mosquitoes. So therefore, prevalence is going to fluctuate due to where the mosquitoes are. If we look at these different types, again, these on this slide here, anyways, these are all carried by the mosquito. So we have yellow fever. This is endemic in Africa, in South America, dengue fever in Asia and Africa, and then chikungunya, endemic in Africa. So again, not a lot of these are going to be prevalent in the United States, but due to travel, they can show up in our patients. And then a couple others, so Ebola and Marburg fevers, these are endemic into Africa. And then the Lassa fever also found in Africa. So if we look at kind of the summary table here, so the yellow fever is caused by yellow fever virus. Pretty easy to remember that one. Again, transmitted by the mosquito. It does disrupt clotting factors. That's what leads to the hemorrhaging. There is a vaccine available, but treatment is supportive. But one of the distinctive characteristics is some liver damage that's caused by, or that leads to jaundice. Dengue is caused by dengue fever virus. Again, a little easier to remember these. Again, also carried by that mosquito, and again, still disrupting those clotting factors. There is a new vaccine that's available for individuals living in endemic areas and in the United States. Again, supportive care, a little distinctive feature. So breakbone fever was named due to the severe pain in some of the forms. So it feels as if the bones are actually breaking. A couple others, chikungunya, again, a little easier to remember these, chikungunya virus, also spread by those mosquitoes and disrupt the clotting factors. So again, these kind of have some commonality that help them to be a little easier to remember. Again, supportive care, and then they can cause kind of arthritic symptoms as they develop. And then Ebola and Marburg, again, caused by the Ebola virus or Marburg virus. Now these, instead of being carried by those mosquitoes, these are from direct contact and body fluids, but still same effect. They're disrupting those clotting factors that's leading to hemorrhaging. There is a new Ebola vaccine that's available for different epidemic situations. And there are some new drugs being discovered. Again, here with this one, there is massive hemorrhaging. Again, they all cause hemorrhaging. But Ebola and Marburg cause a large amount. It is very extensive, and sometimes a rash can be present. This is referred to as a bioterrorism agent that can be used, unfortunately, to cause in some type of terrorist attack. And then our last one here for these, the Lassa fever, caused by the Lassa fever virus. Again, just like with Ebola or Marburg, these are caused by the direct contact, so not using the mosquitoes for these, but still disrupting those clotting factors. Prevention is by avoiding rats who are kind of carriers of it, and then some safe food storaging. There is treatment for it. Distinctive features are some chest pain, even some deafness can occur in these individuals. And this also is on our bioterrorism agent list. Now into the non-hemorrhagic fevers. So these are characterized by high fevers due to the presence of the antigen in the blood. However, it does not lead to hemorrhaging, hence the name non-hemorrhagic fevers. And most of these are caused by bacteria. There is one caused by a protist. So again, the viruses mainly cause the hemorrhagic, bacteria more the non-hemorrhagic. And then our list here of the different diseases caused by bacteria: brucellosis, Q fever, cat scratch fever, trench ehrlichiosis, anaplasmosis, and then spotted fever. So looking at each of these, brucellosis is caused by, has this kind of Malta fever, undulant fever, and Bang's disease. So a few different names for these. Brucellosis is mainly named because of the bacteria that causes it, called Brucella, which is a gram-negative cocci. These are interesting because they can live inside phagocytic cells. This is actually how they get into the bloodstream. They kind of hijack our immune cells. And that also causes some lesions where we find these phagocytic cells, so the liver, the spleen, bone marrow, and the kidney. Again, kind of a fluctuating pattern of fever. So high fever, low fever. So that's why I get the other name is called undulant fever, because it goes up and down. Q fever is named because the Q is for query, because it was so frustrating trying to determine the cause of this disease, which is now known to be Coxiella burnetii, which is a small pleomorphic, which just means it can have multiple different shapes. The gram-negative bacteria. It is an intracellular parasite, and it kind of forms a spore-like structure. It's not a true endospore, but again, these can be kind of dormant and go into that resistant state. But again, they need to be inside of the cell in order to reproduce. That's our intracellular parasite part. And ticks actually play an essential role in transmitting these, but they do not transmit the disease to humans. So it does play a role in animals, but not in humans. In humans, we get it from contact with infected animals, not from the ticks. Cat scratch fever caused by Bartonella henselae, and small gram-negative rod, fastidious, so it can grow on blood agar to help in the detection of it. But it gets its name because it is usually connected to some type of claw or bite mark from a cat, because about 40% of cats have this bacteria, and the symptoms don't start until a week or two after exposure, and it's caused by some small papules at the inoculation site. Then the lymph nodes start to swell, which is what we see in the picture here, and they become pus-filled. And about a third of the patients experience a high fever with this, which is what categorizes it here. Then trench fever, caused by kind of a similar, same species, so Bartonella quinnata, and this is carried by lice. So it's actually spread by their feces, and that feces enters during a bite wound. So this is mainly Europe, Africa, Asia, but this urban trench fever, about 33% of homeless individuals in San Francisco have lice that harbor this bacteria. Symptoms show up about a week, almost a week, of fever. They have leg pains, headaches, chills, muscle aches, and a macular rash that can occur. And again, because we are talking about a cardiovascular disease, also can cause endocarditis. Then ehrlichiosis and anaplasmosis. These are caused by small intracellular bacteria that's carried by ticks. So Ehrlichia schaffensis, and then Anaplasma phagocytophilium. So these are cause kind of similar symptoms So they lead to a febrile state, headache, muscle pain, some rigors, and most of them recover rapidly with no lasting effects. Then babesiosis, this is the unique one that is caused by the protist instead of the bacteria. However, it is going to look a lot like the Ehrlichia and the Anaplasma, also carried by the ticks, but the treatment though is going to be different because it's a protist instead of a bacteria. So the antiprotozoal drugs are going to be used for these. Spotted fever, rickettsiosis, Rocky Mountain spotted fever is the most common or well-known of these, and these can occur in the U.S., Canada, Central and South America. It's caused by Rickettsia rickettsii as a causative agent. It is also transmitted by those ticks. Some of the signs and symptoms, again, fever, chills, kind of headache, muscle pain. The rash that comes along with this is kind of unique, that it shows up about 2 or 4 days after symptoms start. If it's untreated, lesions can emerge and become necrotic or kind of damaging. Also can lead to some cardiovascular disruptions such as hypotension, low blood pressure, thrombosis, and can lead to some hemorrhaging. And about 20% mortality if untreated. The picture of the tick and some of the rash, kind of what the rash looks like in Rocky Mountain spotted fever. Again, the rash doesn't show up though until a few days after being infected. Our summary figure for these non-hemorrhagic fever diseases, again, brucellosis, is caused by the Brucella species, direct contact, airborne, or from needle sticks. Again, these are the ones that have that intracellular growth, and they avoid destruction by phagocytes, so they can actually live inside of them, and they help with their transmission. So animal control, pasteurizing of milk. There is treatment, so doxycycline can be used with this. Again, it has that undulating fever and muscle aches, kind of unique to it. Like we saw with the Ebola, this is also one of our bioterrorism agents, as well as the Coxiella that causes Q fever. With Q fever, again, airborne or direct contact, can also be foodborne. Again, these are bacteria. These are the ones that form that kind of endospore-like. Again, it's not an endospore, but they do have that type of structure. And there is a vaccine available for those at high risk. It's not a common one that's given. And then treatment is an antibiotic, tetracycline. As far as distinctive features, it can be airborne. And it has kind of a variable disease presentation, which does make it hard to diagnose. And then our cat scratch fever, the Bartonella. This is caused from those cat scratches or bites, so it's parental. It does produce an endotoxin, so cleaning wounds are really important after bites, and then treating with antibiotics. Again, kind of looking for those cat bites. But there is not always a fever that comes along with those. French fever is also caused by another Bartonella. This is transmitted by lice. It also produces that endotoxin, so avoiding lice is important. Again, antibiotic treatment is available, and it is very common to cause endocarditis in a long-term fever. So a 5-day fever is relatively long in regards to fevers, which makes this one a bit unique. The Ehrlichia also transmitted by vector here, though I'm looking at the tick instead of lice. So again, avoiding ticks, treatment with doxycycline, and these are the ones that are somewhat common in the United States. Then the anaplasmosis, caused by that Anaplasma species, again, also transmitted by ticks, so avoiding those. Treatment is similar to the Ehrlichia, so doxycycline, and these are more going to be found in the Midwest and northeastern parts of the United States. And our last two, the babsiosis caused by the Babsia species, also transmitted by the ticks. So avoiding ticks is the best prevention, but there is treatment. Again, this is the protozoa, so using antibacterials and antiprotozoals for this. And this is another one that we can see in the northeastern and upper Midwest in the United States. And then our spotted fevers caused by the Rickettsia species. Again, Rocky Mountain spotted fever is the most common, also transmitted by ticks. And these actually induce apoptosis, which is controlled cell death of the lining of the blood vessels that cause a lot of the symptoms with these. Again, avoiding ticks and then treatment with doxycycline. And then as mentioned, again, Rocky Mountain spotted fever is the most common, but also the most severe. So it causes the most amount of hemorrhaging, mass hemorrhaging that we see with these.